Tonight we talk about hypertension. We are joined, as always, with Alice from Kenya and Dr. Hiba, Dr. Alice and Dr. Hiba, who will enlighten us on the best ways to look at our diet and how it can impact on hypertension. And as you all know, I mean, this is no secret to any of us about how hypertension is impacting on the African and the Caribbean community. Hypertension is known as the silent killer, because so many people are walking around with undiagnosed hypertension. I read a report quite recently, just mentioned a number of people that had recently been they had some checks done, checks done at a drop-in clinic. They had some physical checks done, and in those people that were tested, there was 14 out of, I think, 20 people that were diagnosed with high blood pressure. And I think what that tells us that, yes, it was a really high number, surprisingly so. And, the people, they talk about white coat hypertension. So when we have our blood pressure check, that sometimes our blood pressure goes up. But it was up significantly that it brought this to the attention of the nurses, who have made referral or encouraged people to go and see their GPs to make sure that it's not that it is, if it is a one-off, that it's seen as that, but for it to have further investigation if necessary. So without any further ado, I will hand you over to Dr. Alice. Thank you, Dr. Alice.
Thank you very much. So today we'll be talking about dietary strategies for managing hypertension. So just like Karen has introduced us, hypertension is a silent killer, and it means a lot of people actually walk around without knowing what their blood pressure is, but it is good for you to actually check your blood pressure. You don't have to have symptoms, check blood pressure, check it. Sometimes people are rushed to the hospital, they have had a stroke. They find that they had high blood pressure for a long time. Or if you're just feeling really abnormal, just measure your blood pressure. So I'm always here because of courtesy of Sahara Nutrition. So let's start by really defining what is blood pressure. So blood pressure is the force of blood against the arterial walls. Systolic blood pressure is when the heart beats, and diastolic blood pressure is when the heart relaxes. So blood pressure is always written as the systolic over diastolic. So the systolic blood pressure will always be higher, 100 and something, and then the diastolic blood pressure is always lower, 90 something. Of course, when it goes to higher numbers, then it's abnormal, but we will discuss that. So this is blood pressure. So what is high blood pressure? High blood pressure is when the blood pressure is consistently high and is, of course, circulating through your arterial walls. So it increases the chances for heart disease, kidney disease, or you can have a stroke. It has no warnings. Like we have said, it is a silent killer. Most people are killed by this, or by the time you identify it, it's damaged your kidneys, it's damaged your heart, and it's given you a stroke. So always take every opportunity to take a blood pressure. So why is it very important? Why is blood pressure important? Because it makes the heart work too hard, it makes the walls of arterial walls hard, it increases the risk of heart disease, like you've said, kidney and all that. So it's important to know your blood pressure. So let's talk about the effects of blood pressure. So we've seen that already. I've mentioned that if you have high blood pressure, it's the highest risk factor for a stroke. It can cause a break in a weakened vessel, which then bleeds in the brain, which is what is called aneurysm. So this is a risk. So it affects your brain, it affects your heart, because it can it's the #1 risk factor for congestive heart failure. Also, when the blood pressure is not controlled, if it's consistently high, your heart becomes enlarged. And so that creates a whole new problem. It can also damage your kidneys. And kidneys, we know it acts as a filter to rid off the body waste. So high blood pressure will narrow or thicken the blood vessels, and the waste build up in the blood. And this can result in kidney damage. When the kidney is damaged, then it also affects the blood pressure. So it becomes a vicious circle. Blood pressure is high, kidney gets damaged. Kidney gets damaged further, it increases the blood pressure. And of course, also uncontrolled blood pressure can also cause can also cause the blood vessels to break and bleed in the eye, and you can have a blood vision. In fact, you can actually get blind. And for your arteries, that consistent high blood pressure in your arteries will cause your arteries to harden, and this affects your heart and your kidney and all the other organs that we've talked about. So, what are the causes of blood pressure? What do you think is the cause of blood pressure? Hiba, would you like to try?
Yeah, so just like the other conditions we talk about is multifactorial. So lifestyle is one, healthy dietary behavior is one. Stress.
Okay, dietary behavior, stress. Yes, Karen? You're muted.
Overweight. Someone says overweight in the chat.
Being overweight was what I was going to say. Caddy's also said the same thing. But yeah, carrying excess weight.
Very good. So you're all right. But we have two types of hypertension, or three. We have the essential hypertension. Nobody knows the cause. It may be genetic because it's found in certain families, but we cannot tell you what the cause is. So, and these blood pressures also tend to be very, very high and very, very difficult to control. Then, of course, we have what is called, we have blood pressure due to medical condition. It can be the kidney damage, which can affect your blood pressure, or other kidney infections or some other conditions that have been known to affect blood pressure, or side effects of medication when you have a chronic condition. Like if you have diabetes, you're going to trigger hypertension if it is not controlled. If you have even people with HIV, because of long-term intake of all this antiretroviral therapy, some of them end up getting hypertension. So it can be because of a medical conditions or side effects of treatment. And then we have lifestyle, which you all have said. So obesity, dietary habits, stress related to mental health. And sometimes we get blood pressure just because if you're female, you're 40, it's called the 3 Fs, female, 40, and fat. You're likely to get hypertension. Even men, when they get to the age of 50s plus, then they're likely to get hypertension just because of age. So being older also increases your risk factor of being hypertensive. And so now let me give you some normal readings, some levels for blood pressure. So if you, and Karen had alluded to it, if you go and measure your blood pressure today, if you get anything 120, which is your systolic, like we said, over 80, which is your diastolic, this is a normal blood pressure. So if that's what you always get, it's fine. But if you're 16, you're a teenager or 18 years old and you're getting 120 over 80, then we also can say that's an optional hypertension. It means that your risk of being hypertensive is actually high. 120 to 139 over 80 to 89, this is pre-hypertension, or what I know a cardiologist who likes to call it optional hypertension. So if you go find your readings and you're between 80 and 85, he actually said it's optional hypertension, meaning you have a choice. You change your lifestyle, you prevent it. You do nothing about your lifestyle, you get it. So instead of calling it pre-hypertension, let's call it optional hypertension, meaning the choice is yours. And then, of course, when your blood pressure is 140, 159 over 90 to 99, this is stage 1 hypertension. And of course, lifestyle is always the first line of treatment, but sometimes you will have to be put on medication. When your blood pressure is 160 and the lower diastolic is over 100, this is stage 2 hypertension. So you have to always, when you're hypertensive, you have to monitor your blood pressure. And it's always recommended that you actually buy a machine and keep it at home. Like Karen said earlier, a lot of people suffer from what we call white coat syndrome. So the minute you go to the hospital, you see a doctor, you see all those nurses in their uniform, your blood pressure goes up. But so it's recommended to always also check your blood pressure at home. So when you are hypertensive and you're on treatment, you're on medication for treatment, and of course, hopefully you're being seen by a dietitian and dietary management and lifestyle, then your blood pressure should be always around 130 over 80. That means you're well controlled. So if you're on medication for treatment and you're still getting 140 over 90, 150 over 100, then it means that you're not controlled, because the medication is to control your blood pressure. Many times I've come across patients where they've been told they're hypertensive, they've been said to me, oh, is there something we can do with diet? Yes, there's always something we can do with diet. But when you're managing your diet and your blood pressure is still consistently, diastolic is 150, systolic is 150 and diastolic is 100, and you're on diet and exercise and you're not on medication, that's a risk factor for stroke or kidney damage waiting to happen. Please do not imagine that you can manage your blood pressure on diet alone. You can manage it on diet alone. If you're getting 130/80, we're fine. That's good. But if you're managing on diet and you're getting 150/100 and all those numbers, then it means you need medication. That medication is a protection. Because remember, the blood is moving with very high force against arterial walls, and it is abnormally high. So it can damage your kidney. So please don't do that to yourself. I've had a lot of clients like that who do not want to take medication. Then I tell them, at your own risk, I'm not working with you. I won't even manage you. I won't even put you on diet if you're refusing to take medication, because you'll come and blame me. So we won't take the risk. So tell me, from all this knowledge you've talked about, who can develop blood pressure?
Anybody, I would say.
Thank you. Anybody can get blood pressure. You know what was surprising? Nowadays we have actually pediatric hypertension. So when you're feeding your children with all these processed foods, we get pediatrics with high blood pressure. I could not believe it, but yes, I have met them in my practice. 8 years old, 10 years old, 12 years old with high blood pressure. Why? Of course, because of lifestyle. So children are getting high blood pressure. So my friends, please take care of your children. Don't give them trouble. So anybody can get hypertension.
Yes. Can I just add? Sorry, Alice, yes. When you asked about who can get hypertension.
Yes.
Evidence also shows that so people of the African and Caribbean descent here, by ethnicity, tend to be at a higher risk of getting hypertension as well. So all of us here are at a higher risk than our white counterparts.
And then also you're also at a higher risk, especially because when we come to Europe or we migrate, we change our dietary habits. We leave our healthy dietary habits, natural foods, fresh foods, come and eat a lot of processed foods in your diet, and then that increases your risk. And it's not just a risk. Even the statistics show that the Black and Caribbean, Black Africans and Caribbean immigrants have high blood pressure. They are more likely to get stroke. They are more likely to get kidney problems. They are more likely to get all the complications of blood pressure. So please I hope they're all listening and they're going to do something about this. So prevention, what do we need to do? Elizabeth, tell me something. Let me see who is in the audience. Cardi, Orlando, Toiba. How do you prevent hypertension? Orlando, you know the answer. That's what you do for a living. Huh? It's probably not available. Yes, Elizabeth? Exercising. Keep fit, yeah? So let me just rush through this so that we can go to the diet bit. So we have to adapt a healthy lifestyle. So let's start with your lifestyle first, because sometimes it's your lifestyle. If you don't get enough sleep, you don't get enough rest, you don't manage stress, because we have stress, but sometimes the stress must be managed. We have, reasonable stress that you can live with, traffic jam and all these things, but you have some other stresses that you can't just let go. You have to manage. And then, of course, always remember to identify your toxic habits. What are your toxic habits that can actually increase your blood pressure? And then when it comes to dietary management of blood pressure, reduce your salt intake. And how do you reduce your salt intake? You also reduce your salt intake by not eating processed food. So if you eat refined foods, I think we've talked about this, how it is dangerous, cancer causing, low immune, and all those things. Just stop eating your processed foods. Occasionally you can have it, Yeah, take minimal alcohol, follow a healthy eating plan, which is what you're going to talk about just now. So what is the DASH diet? Everybody's talking about it. It's been there for years. It's one of the most popular diets. It's called the DASH diet. It's called Dietary Strategies for Hypertension. This was a study that was done. It was actually done for a very short time. We know that people have blood pressure for life, but this study was done. It was just an 11-week trial, which is like short of 3 months trial. And what they did is they just increased, you're living in your own, wherever you're living, they increase your vegetable intake by 1. They increase your fruit intake, 1 to 2 fruits, and included at least 4 to 5 servings of nuts, seeds, and beans in your diet. So they increased the healthy things in your diet. And what happened with this, so if you ate more vegetables in your diet, and you ate more fruit in your diet, and you ate more seeds and nuts in your diet, and beans, a lot of beans, then this reduced the blood pressures significantly. So it means that, and this is what we've been talking about eating healthy, counting your carbohydrates, not eating meat at night. I mean, we're talking about all these things. So this is just a reminder and specific to hypertensive. So you need to watch your vegetable, your fruit intake, and your seeds. Seeds and nuts are very good for your health, and your beans. So what do we need to do? You need to actually make sure you eat fresh food, okay? Fresh. Always fresh is your first priority. And sometimes we live in environments where you can't find fresh, then you can get frozen. And of course, if you use fresh poultry, lean meat, and fish, remember what you've talked about before? Try to buy fresh, not processed. And then, of course, use your natural herbs and spices and seasonings in your food instead of salt. Remember, we've had a whole topic about salt as well. So, in other words, it's just doing the healthy things and paying attention to specifically where your food is coming from. You can see this is not processed. So when these patients were put on, they were just given basic information, their blood pressures reduced, and some of them even, if you read follow-up studies, they even reversed their blood pressures. So another recommendation related to reducing and preventing blood pressure is reduce your blood volume. So if you're hypertensive, how do you reduce your blood volume? You reduce your blood volume by reducing your weight. So lose weight, lose at least 10% of your weight. Even if you're, 200 pounds, if you lose 10% of your weight, that is 20 pounds. It has a significant effect on your blood pressure and on your health. And of course, as Elizabeth told us, and Orlando is waiting to implement, be physically active. Remember the 6 natural doctors: laughter, oxygen, sunshine, okay? Physical activity, water. The natural, those actually, if you do all those, your medication, even your dosage for blood pressure will be lower. So remember, when you don't exercise, you don't eat healthy, you don't sleep enough, you don't do all these things that are healthy, associated with healthy lifestyle, your medications will be, your dosage of medication is higher, and you increase your risk of getting complications. These conditions are progressive. So when you don't manage them well, they only get worse. So you're going to live long enough to get complications of blood pressure. And last but not least, limit alcohol, quit smoking. And when you are really hypertensive, then you can get treatment. Dietary works and all those things you said works, but most importantly, at some point, you may need to be on medication. So you see your physician, keep a record of your blood pressure so that you can be able to interpret, is it always high or is it always normal? Ask lots of questions. You must see a dietitian and a health educator. So in short, taking drugs without eating properly is like washing your hands and drying them in the dirt. Thank you. I welcome questions.
Thank you so much, Alice, for a really informative and engaging session there. That was really lovely. I've just received a text. I think somebody might be online, and they wanted to know if you follow the diet suggestions that you've given us. Is there a possibility that you could come off medication? You could reverse your blood pressure and eventually come off medication?
Okay, yes. And remember, then we have to go back to what is the cause of hypertension. If it's essential hypertension where nobody knows the cause and the doctors can always determine this, then we cannot promise you. We can promise you that you can control your blood pressure and prevent the complications related to it. But if your blood pressure is because of your lifestyle, then yes, we will reverse hypertension and you can cut off your medication. So the trick is always to make sure you monitor, and your goal is always to get 120/80. Yeah, so you can reverse it.
Thank you.
So Alice, thank you very much. I just wanted to comment on that slide where you talked about the numbers, because there's a campaign in the UK starting today, or is it yesterday? I think I watched it on BBC. That is Know Your Numbers. So I was really happy when you talked about that slide into detail. So it's a reminder to us to always keep checking to have a record of our blood pressure and the other numbers that we'll be talking about in the coming weeks. Now, there was something I wanted to also highlight. You mentioned salt, as reducing the intake of salt. However, I've come across people who reduce their intake of salt, but then go on to take so many things like, condiments and, mayonnaise, ketchup, and things like that. So I just wanted you to comment on that, because the fact that you're reducing your salt intake does not mean you're not having lots of sodium intake. So could you just touch on that for me, please?
Okay, thank you. I think that's a good question. So let's talk about sodium instead of talking about salt. Salt is sodium chloride, so provides you with sodium and chloride. Those are electrolytes that you need for your body to function efficiently, but most of it is sodium. So when you talk about sodium, you can actually get it from natural food. So when you eat a variety of fruits and your vegetables, everything you eat, if we quantify, it can actually give you sufficient sodium. So one of the things I think I mentioned is always, when you want to make sure that you reduce your salt intake, which is your sodium chloride, then stop processed foods. That's the number one way of reducing your salt intake. And then, of course, you never need to add salt in your food. And I think we've talked about this before. The tongue is very, very good. Within 21 days, you can start tasting something new or stop tasting something. So you can eat food without salt. Remember, it's not that taste that you're looking for. It's the micronutrient sodium, which you get from just consuming foods. So, and one of the things that significantly helps reduction in blood pressure is actually reducing your salt intake. And if you go on and read about salt, even countries have put taxes on, salt and salty products, so that things which are salty are high, or they put standards on how much salt should be added on bread, or should be added on cake, or should be added on different things. Yeah.
There's a question in the chat box from Kadi.
Mm-hmm.
Trying to look for it, but I remember reading a question from Kadi. When do we say one is hypertensive?
Mm-hmm. When we say one is hypertensive, when your blood pressure is consistently above normal, which we said it's your blood pressure is consistently 140 over 90 or above, consistently. Like every time you go to measure, it's consistent. What happens sometimes when a patient comes to the practice and then you take their blood pressure and then you say, have you ever been told your blood pressure is high? Then they'll say, yes, I was told. And I was like, what did you do about it? Nothing. So what I say, if I get somebody's blood pressure, it can be high today for many reasons, including white coat syndrome, but I make them take their blood pressure reading for 2 weeks. And that is when I will get them off the hook. If it is normal, that's fine. If it is high, then it needs to be treated. So you need to keep a blood pressure record of a minimum of 2 weeks if you've been told before that your blood pressure is high. And if you're getting consistently 140 over 90 or above that, then you know that you have high blood pressure. Thank you. Mm-hmm.
I can't see any more.
Sorry, I made a comment there, Hiba, and I think there's been much encouragement, not just from this session, but also the sessions that we do on a Saturday with health in the health hour, where one of the best things you can buy somebody is a blood pressure machine. And one of the doctors says that for Christmas, I think he bought his relative blood pressure machines so that they could check their blood pressure. And they're not so expensive. It's cheaper than a night out, and something that could actually will potentially save lives, because not just one person will have use of that blood pressure machine. So I would encourage people, especially when we have, it's not so easy always to see our doctors, or we don't see our doctors in the regularity that we might have done ordinarily. So you might be getting symptoms of high blood pressure, but because you think, it's too much hassle to go to the doctor, you don't go. So I would encourage everybody, if you can, to invest, and I use the word invest, in a blood pressure machine, because it can really be life-changing and life-saving.
Yeah, I think that's the best idea I've gotten in a while. Buy your loved one a blood pressure machine. It's cheaper than a night out. I agree with you. I agree with you. So I'm going to do that. I always buy for my relatives, especially the older ones. But I think I also want to do a campaign on Know Your Numbers. I haven't done a campaign in a while. So please send me the YouTube link or the link for this BBC.
The UK.
In the UK. Let's do it here. I want to do it here as well. Yeah.
Karen, I just have a last comment. So, you know, a lot of people seem to think that the DASH diet is, and I know you've explained this all right, but I just wanted you to highlight it before you leave, is a particular diet. Can we just say that it is just a wellness, you know, the public health diet or approach to eating that we keep encouraging, and not necessarily a specific, you know, guideline for just people on hypertension? Am I clear or right to say that it is an approach that we can adopt as a family and not only for hypertensive patients?
Okay, was that question? I thought you said Karen. So,
Sorry,
yeah.
I meant Alice.
So this is, yeah, and you're so right. It's not, initially they say to stop hypertension, but no, it does not stop hypertension. Remember, there's some hypertension that must just be controlled over a long time. But these are approaches. And like I've said, in this, I mean, for the last many months, we've talked about different things where you should not eat processed foods. We've mentioned things like don't eat protein at night because the amino acids increases your glomerular filtration rate and your blood pressure will go high. So we keep getting these approaches everywhere. And actually, it's just eating healthy approaches. So if you're not hypertensive and you're sitting at home and you apply this, increase your fruit intake, increase your seeds, increase your vegetable intake, sleep better, quit smoking, reduce your alcohol intake, you're going to benefit. So yes, it is not really for hypertension. They are just dietary approaches to eat healthy. Thank you very much. But it was because it was done on hypertensive people, that is why that is why it's called hypertension. And like I said, this was, you know, we have hypertensive for life, for years, 20, 30 years. This was an 11-week study or 3-month study that shows that if you change your lifestyle, the impact in 3 months is very, very effective. So let's do something.
I think that's amazing, Alice. And Iba, thank you very much for sort of reminding us really that, you know, changing our diet to a good diet. Now I'm saying changing it to a good one, not a bad one. You know, taking some healthy lifestyle choice, dietary choices will impact on so many different things. You know, I mean, Dr. Alice says she's passionate about diabetes, but we know if we adopt some of these great the great advice that we've been given throughout the weeks, I know I can say for myself that the weight is coming down slowly, and that's not by me sort of counting calories. It's just, you know, reducing that salt intake, looking at my portions, trying to reduce the processed food, all those little nuggets that you've given us. I think my blood pressure's also come down. I've not checked my number, so I'm going to know my number by the end of today. But I think, you know, what we're saying is that it's subtle difference, and that's not me really focusing, you know. So imagine if we really focused the difference that we could make, as you said, in 12 weeks. You know, if we made some real focus, then we could really make some massive differences. I guess it's who's up for that challenge, eh?
Yeah, thank you. So remember, taking drugs without eating properly is like washing your hands and drying in the dirt. So people are always rushing for medication. Lifestyle is the first line of treatment and then medication.